And welcome back. A big change when it comes to COVID-19 that could affect all of us. The CDC expected to shift its COVID isolation guidance this spring.
According to the Washington Post, people may no longer need to isolate once they have been fever-free for 24 hours and their symptoms are mild or improving. Currently, people who test positive are advised to stay home for at least 5 days to reduce the chance of spreading that virus to others. DC
News Now's Chris Flanagan spoke with the chief medical officer at Frederick Health about the potential changes.
Dr. Weishart, why is the CDC potentially changing the guidelines, and do you think this is the right call?
The current guidance, while very conservative, probably does need to be, adjusted somewhat. Not only are there challenges in keeping folks accountable to the guidance that is currently present, but there also is an economic impact when you're pulling people out of the workforce for longer than you need to. And so I think it's the right move to discuss it. And I think it is time to really think about how do we align the way we treat COVID with the way we treat other viral respiratory illnesses such as influenza.
Dr. Weishart, some people might say, you know what, loosening the guidelines might lead to more transmission. Are you concerned about that at all?
I'm not really concerned about it. I think, a couple things to think about is, number one, there's a lot of people that may not even know that they have a COVID infection at this point. Therefore, they're not following current guidelines anyway. We have some people that know they have COVID but don't follow guidelines. So I actually think changing the guidance actually is going to align more with current practice than what we currently have.
Dr. Weishart, what about when it comes to wearing masks? Do you still recommend people wear masks after being infected for 10 days or so?
I would say some of it depends on the situation that you may have. If you know you're going to be visiting with someone that has a weakened immune system, I think wearing a mask is still a very responsible thing to do and would encourage actually that both people in that situation wear a mask. But, I do think we could probably lighten up on that. And what you've seen out in the community is people aren't following that guidance either, unfortunately. So that's the situation we find ourselves in.
Dr. Weishart, great information as always. Really appreciate you taking some time. Thank you.
Thank you. It's always a pleasure. I appreciate it.